We are gonna be speaking about the differences, the similarities, the treatment options of both PMDD and PMS. So yeah, let's get started. Okay, so the similarities between PMS, which is premenstrual syndrome, and PMDD, which, like I've already said, is premenstrual dysphoric disorder. You will get the mood swings, the cravings, the breast tenderness, the fatigue, whatever people who have PMS get in the luteal phase of that period, people with PMDD also experience. So there's no real difference in the type of symptoms you experience. The only difference is with the intensity of the symptoms. So the second similarity is that, like I've already said, the symptoms both come at the same time. So if a person gets PMS in the week leading up to that period, a person who gets PMDD also gets the symptoms in the week leading up to that period. So that's why it's hard to know which one a person has, or whether we are not just mixing things up and we're not mistaking one for the other. It's important to note at this point that if you experience symptoms even after you get your period, so the luteal phase is in the 1 to 2 weeks leading up to that period, that's when most people typically start experiencing the symptoms. But if even after you get your period, say on day 7 of your menstrual cycle, if you still have the mood swings, the tender breasts, the fatigue and lethargy, or whatever is characteristic of your particular symptoms of PMS or PMDD, if you get them after your period or not in the luteal phase of your menstrual cycle, it may be indicative of another condition that you need to see your doctor to find out what it could be. So yeah, that's a side note. And then the difference between PMDD and PMS is that only 3% of women of reproductive ages or people who have these symptoms meet the diagnostic criteria of PMDD. And in contrast, 80% of all women report to experiencing at least once during their reproductive years symptoms of PMS. So yeah, PMDD is not very common and it's hard to diagnose, because actually the second difference is PMDD is actually listed as one of the mental health disorders. So yeah, that's how serious PMDD is. It actually gets to a point where it interferes with a person's ability to function socially and even physically. People will just be curled up in bed for days on end, like it's bad. So yeah, that's the third difference, is that PMDD is debilitating. And I know when you experience PMS, you will feel like, okay, this is really intense, this is bad, or you're weeping, or you're moody, and the cravings are ridiculous. So to a person who's experiencing PMS, they may feel like, hey, you know what, this is hectic. But with PMDD, it's even more severe than your typical PMS. So that would be the third difference. The risk factors for PMDD are if you have a personal history of mood disorders, or there's a family history of like major mood disorders such as depression, or if you've experienced premenstrual depression. And again, I know when you're going through it, you may feel like during your PMS phase you are depressed, or if you're a person who generally struggles with depression, or you've been diagnosed with depression, you may feel like, oh, that's me. But it's different. Like premenstrual depression and your typical depression is different. PMS mood swings is different from premenstrual depression, which is the risk factor for PMDD. So these are things that's why I said go speak to a doctor. These are things you have to professionally see someone and be diagnosed with, so that you start working your way towards getting the diagnosis that would actually be helpful to you if you really do have PMDD. The lifestyle modifications you can adopt, which are, by the way, important for everybody, not just people who get that period, and to not just do in the 1 to 2 weeks leading up to your period, which is when you typically experience the symptoms of PMS or PMDD. But I mean, we've spoken about this. Everybody knows. Eat green leafy vegetables. Eat nuts and fish oils. Exercise and drink plenty of water. Get enough sunlight. Reduce your dietary salt and sugar intake. Quit smoking. I was gonna say quit alcohol, but let's stick to reduce your alcohol intake to maybe a glass of wine with your evening meal, or less regularly perhaps. But yeah, they seem typical. We say these every day, but yeah, those are really, they help. So try to do that and see if they won't help with your PMS symptoms, or they won't make some part of your life more bearable, even if you've been diagnosed with PMDD. And then I say see a doctor, find practice. There's actually there's organizations that help raise awareness for PMDD. There is doctors who work specifically with people with PMDD. Well, not in Lesotho, but there's organizations. That doctors work remotely though. So I know of one in Boston. They are beautiful. They do marvelous work. They have support groups, they have webinars, they have doctors and trained professionals. They are a group of women who are living with this problem and have actually been diagnosed, that help people who are not able to find people who would be able to diagnose them in their own countries, and they help you manage and live well, essentially, despite the condition you may have. What people with PMS, we typically soldier through it. There's no treatment, you just deal with it. But with PMDD, there's hormonal treatments, there's antidepressants, there's non-steroidal anti-inflammatory drugs, and there's diuretics. Those are treatment options for people who are suffering from PMDD, but they need a prescription. All of them, you'd need to see a doctor and get the proper diagnosis and get a prescription for either one of these drugs or any combination of any of the 4 drug classes I've spoken about. And I'm not going to give examples because I refrain from doing that. I mean, I know I do it sometimes when we're chilled and it's easy conversations, but with things like this, like things that are really, really serious, and things where we are not as a country in a position where we've in our health systems progressed enough to have the tools or the resources to diagnose them. It's easy for somebody who has really, really intense PMS symptoms to watch a video like this and say, hey, that could be me. And so if I give a name of a diuretic, for example, they could go to the pharmacy, or an NSAID, because it's an over-the-counter medication. Go try to see if they can get that. And that's not what I'm trying to do. I'm just trying to, with this particular video, only raise awareness so that you know if you've been treated for depression, you've been treated for PMS and period pains, or this or the other, and it's not working, and you've not found somebody who could help you. I'm just saying, you're not alone. You're not a crazy person. It actually exists, and it's a mental condition, and it is called PMDD. So yeah, I'll link the resources for IPMD in the description, so that at least even if you've not gotten a diagnosis yet, you can see if you can't get help speaking with people with the same problems and finding out how they deal with that particular situation.